Cardiovascular disease in middle adulthood. At the heart of our bodies is our cardiovascular system, which performs essential functions to keep us alive. Prevention awareness and incorporating healthy lifestyle routines into our daily lives can help reduce risks for the prevalence of cardiovascular disease in middle adulthood. Our cardiovascular systems are linked both anatomically and functionally to all other body systems. As cited in our net, according to the World Health Organization, the leading cause of death among adults worldwide is cardiovascular disease, commonly referred to as coronary heart disease. Cardiovascular age-related changes. As we age, especially in middle adulthood, our cardiovascular systems undergo three distinct age-related changes. These changes can first be seen in the blood with a decrease in hematocrit levels, in the heart with a decrease in maximum cardiac output, and in the blood vessels with an increased likelihood for developing atherosclerosis. Risk factors for cardiovascular disease include smoking, high blood pressure, high cholesterol, specifically the LDLs, which are low-density lipoproteins known as the bad cholesterol, diabetes, emotional stressors such as conflict and arguing, obesity, genetic predispositions, and having a sedentary lifestyle. Conflict and heart disease. Interestingly enough, it has been found that conflict between spouses is directly correlated with heart disease. As cited in Kettering's study, fighting between couples was found to be worse than smoking and diabetes put together. What they found was that husbands were twice as likely to develop cardiovascular disease if they had hostile wives while fighting. According to Lamanna, couples have to negotiate differences and challenges about their children, money, household chores, in-laws, and other relatives, how to allocate their time, and irritating little habits that each one of them has. Fighting is inevitable in any relationship, as are daily stressors. However, it is important to do so in constructive ways, such as resolving the issue through compromise. Atherosclerosis is the condition where the plaque builds up in the coronary arteries, causing the passage of blood to become constricted. The first video demonstrates plaque buildup.
Over time, fatty streaks may build into plaque, and plaque may continue to build within the walls of the arteries.
The second video is demonstrating the thickening of the artery wall.
The wall of the artery actually becomes thicker during the progression of atherosclerosis. This thickening is due to plaque buildup over time.
Myocardial infarction. Prolonged atherosclerosis results in a myocardial infarction, commonly known as a heart attack. When an MI occurs, some of the coronary circulation is blocked off, causing the cardiac muscle cells to die off from a lack of oxygen. The result causes the affected heart tissue cells to become non-functional, which creates further heart dysfunction. Here in the diagram, you can see the result of a heart attack. In the bottom right is the dying muscle due to the lack of oxygen being supplied to that chamber of the heart. Here's a diagram depicting common heart attack warning signs. If you experience any of these changes, take action and do not wait. Call 911 immediately.